Hey Julius, it's so great to be with you. I'm so excited for the conversation that we have ahead. Just to give everyone a little bit of a backstory of how Julius and I know each other. We had met each other through a Michael Neal program called Sharing the Feeling, which has been an awesome program. If you aren't familiar with Michael Neal and his work, I highly recommend checking it out. But Julius and I, both being in the medical realm, wanted to come together and have a conversation. So we know each other a little bit, but there's still a lot to explore. So I'm really excited, Julius, to have you with me. Thanks for joining me today. And first, to start out, just I would love for you to share a little bit about yourself and your background. And I should say, Dr. Julius.
Thank you. I appreciate it. Thanks for the opportunity also.
Yeah.
This is great. So yeah, I'm a cardiologist. Was been in practice. I guess I graduated in 1986. I've been practicing cardiology since 92. And one of the things that sort of always fascinated me was human behavior, and sort of the aspect of health that I think we tend to ignore in Western medicine, which I call the non-physical dimension of health. So we do really well with the physical stuff, right? So if you come in with some kind of physical issue that's relevant, usually acute, like a broken bone or belly pain and appendicitis or chest pain and a heart attack, like we can find something physical, we're really good at, setting the bone or pinning it or cutting out the appendix or stopping the heart attack and opening up the artery and things like that. And so we do really well there. Where I think we struggle in Western medicine and modern medicine is in the more chronic kind of states, especially if we don't find anything physical, right? So some people term these medically unexplained symptoms like migraine headaches, irritable bowel syndrome, um, non-cardiac chest pain, fibromyalgia, chronic fatigue, all of these physical sort of ailments, illnesses where, they can be fairly debilitating, sometimes disabling. Migraine headaches are terrible. Irritable bowel can be very debilitating. And yet we don't find, if you do whatever test, you don't find anything on the test. That doesn't mean the patient's not sick. I always say we're not just not smart enough to figure out exactly what's going on. And then, how do you treat that? And I think that's where we sort of struggle. And that's been my interest for really decades now.
Yeah, no, I love that. I definitely feel like that is a missing piece in medicine that we tend to kind of leave out or disregard that we are spiritual beings. So I think that's so awesome that you've come to that awareness as well and see the importance in that. So I'm curious, what kind of led you, or how did that awareness unfold for you? What was your sort of journey in discovering that?
It was a little bit of an evolution as far as my style of practice, but I was always interested in human behavior. As even as a kid, I was fascinated with the placebo effect. As a teenager, like 15, 16, 17 years old, heard about this thing called the placebo effect. And it was just, I was like, wow, this is, what is this really all about? Back then, this is like mid 70s, late 70s. It was a lot harder to get information back then. We didn't have Google and the internet and stuff. And so, um, but I went through, always wanted to go to medical school, went to medical school, and I don't believe in coincidence. It seems to me like everything happens for a reason at the right time. And the last week of medical school, I was doing a family practice rotation. And I saw this patient in the office, and she was really sick, nausea, vomiting, dry heaving for 3 days, couldn't keep anything down. And so I we didn't know really what was going on. So, but she was dehydrated. So we put her in the hospital. We hydrated her up and we ran some tests over about 3 days. And all the tests came back normal. And so I was going to discharge her and I was sitting down, writing her discharge orders and making some small talk, and I said something corny like, well, we'll get you home to where you can get some real rest because you can't rest in the hospital, right? It's like they're always waking you up and bothering you. And she said, "Oh, I wish." I said, "You wish?" I said, "What do you mean you wish?" She said, "I wish I could go home and get some rest." And I said, "Well, why can't you?" And she says, "Well, in the last 6 weeks, my husband left me, my dog died, and my house burned down."
Mm.
And luckily I was sitting there because I think if I would, I may have fallen down. I just remember being completely stunned and these thoughts started racing through my head. I was like, it became intuitively obvious to me why she was sick. It was just like, oh, well, that's why she was sick. That was the first thought.
Hmm.
The next immediate thought was, wait a minute. I'm 2 days before I graduate medical school. I'm essentially done with my education, and I didn't learn anything about whatever this is. That was the second thought. The third thought was, well, then is it a real thing? Must be. It seems like it, but must not be because I didn't learn anything about it. You would think they would teach us something about this. So then I said, well, I have access to a whole medical school library, and I'll go look it up. And I was like, I don't even know where to start to look. Right. And then I
Right.
was like, so then I went and, I had my attending family practice doc that I was working with, and I sort of, talked to him, mentioned to him about it, and he sort of looked at me and he was like, it's probably just a virus, it's probably like a viral gastroenteritis. And I was like, but the next thing thought was, so if we have no idea what's going on, we just call it a virus.
Right, right. Everything's a
And
virus.
but itis at the end of it, and it sounds, like legit.
Yeah.
And then it was a busy time for me. I was in Tampa, Florida. I was moving to Cleveland. We were packing and stuff. But that patient stayed with me like through my internal medicine training and then through my cardiology training. And I saw this repeatedly. Now, most of you, when you do, internal medicine and cardiology training, most of it's in the hospital. You don't do a lot of outpatient stuff. But
Hmm.
even in the hospital, a lot of the stuff that came in was sort of this same type of stuff. And and that was puzzling to me because again, I hadn't seen any of this. Well, then when I went into practice, I started seeing a ton of this in the office. Not just me. I started noticing that every physician in every specialty saw all of these and every specialty has their own thing, right? So again, in neurology, it might be migraine headaches, tension headaches, cluster headaches. We got all these different names for it, right? You got
Hmm.
cervicalgia and you got back pain and you've got non-cardiac chest pain and belly pain with irritable bowel and fibromyalgia and all this chronic fatigue is a big one. So a lot of primary care sees it, but a lot of specialists see this as well. And we're sort of when I started seeing this in the office, here I was. I trained at the Cleveland Clinic, and I was like, I felt I was well trained. And I had no idea what to do with these patients. It was
Yeah.
like, 40-year-old female comes in with chest pain and palpitations. Not a lot of cardiac risk factors. What do you do as a workup? You move to a simple stress test. Everything is normal. Maybe you do an echocardiogram. Everything is normal. And what do you do now? And and we usually start with beta blockers and all this kind of stuff. And in some of the areas, I think pharmaceuticals are a little bit better than in others. Like in migraine headaches, the pharmaceuticals for prevention have come a long way. Um, Pain treatment is come a long way. Irritable bowel is another story. I think we haven't done very well at all with pharmaceuticals and irritable bowel. But I started to see this, and it was sort of like, what do we do for these people? And so that's where I really got interested in this aspect of what I call non-physical dimensions of health. So you come
Hmm.
in with headaches, come in with belly pain, you need to get an evaluation. Make sure you don't have appendicitis or Crohn's disease or something like that. Make sure you don't have a brain tumor, something physical causing your symptom. 99% of the time, you don't have that. And if we don't find it, what do you then do? And so I called it awareness centered health. Like we started to look at these non-physical dimensions of health. So mental health, emotional health, behavioral health, cultural health, social health, spiritual health. These are things that we we just don't give them the credence that we should in Western medicine. I think it's not that we don't think they're important. We just don't pay attention to them
Hmm.
the way I think we should. And they play a big role, I think, in health, symptoms, and illness. And so that I started to basically try to find ways to not only address, assess these issues, evaluate them, but then, develop whatever you want to call it, techniques or tools or methods to start to sort of deal with that stuff as well.
Yeah. Um, yeah, I mean, I think it's so fascinating that story that you shared. I get goosebumps hearing it because for me as well, kind of uncovering that awareness that there's this missing link, this person has um all these symptoms. We can't really come up with why they're having them, but then she shared what was going on at home and it made all the sense in the world. And I myself, I know personally, I can see when I'm going through a stressful time or my mind is creating stressful, scenarios in my head, that I can end up sick. I mean, it just happened not that long ago. And so I think that's really amazing that you've discovered that. So for yourself, tell me a little bit about your own personal experience health-wise. I know you've shared you have your different newsletters that you're writing and things, and you've shared a bit about that. I'd love for you to share a little bit about your health journey and kind of how you saw that in your life as well.
Yeah. So then after I went into practice, I found this great group. They in Greensboro, North Carolina. They treated me like a king and things were great. But I struggled again just with just concentrating on, let's call it, acute care kind of medicine. Then the group was, it was a period of time where groups were getting bought by different entities, private equity groups, hospitals, and things like that. So the group was getting bought by a hospital. I wasn't really interested in that, so I went solo. When I went solo, I developed a ton of business debt, right? I had to buy all sorts of expensive equipment. I had $750,000 just in equipment in the office. And those were timed with decreasing reimbursement. And the thing about my style of practice was that it took longer. That's the thing about these non-physical dimensions of health. Like I always say, pharmaceutical-based medicine is very easy, right? Like someone comes in, you look at all their numbers. Hey, here, your blood pressure's too high, your sugar's too high, your cholesterol's too high. We're going to put you on these 2 or 3 or 5 or 12 medicines,
Right.
and
A medicine for all the side effects of that medicine.
right. And I'll see you back in 3 months, and we'll see how that's going. And that's like the whole visit. Like it's fairly straightforward. If you sort of, you know, find out that they don't have a brain tumor for their headaches, and you say, "What's going on in your life? How are you doing?" That opens up a whole can of worms. That's not something you're going to deal with in, the 10 minutes that you have, right?
Right.
And so it becomes really a bit of a challenge. And so I was, and all that to say, I was low volume, and then drew some reimbursements. I was just a lot of stress and a business stress, and I was working to pay the bills basically 7 days a week. For 3 years, I worked 7 days a week without taking a vacation, without taking a day off, and it was just a financial struggle, and I felt like I had to do that, and so I was working really hard, and I probably had some maybe resentment toward that. And I'm not great at identifying the emotions, but it was a strong negative emotion. Let's put it that way. And I developed lupus, and I was really sick. I had just a lot of, joint aches and muscle aches and fatigue, some chronic kidney stuff like creatinine started to go up. And I just was on a ton of medicine, but I was in this position where if I wasn't there, there was no income coming into the group. And so I felt stuck. At least in my thinking, I felt stuck. And I felt victimized, right? Here I am trying to do the right thing and a good thing. And I'm struggling to pay my bills basically and meet payroll and things like that. So it's a very stressful time. So then at this point I'm in my late 30s, early 40s. And eventually, after, I don't know, a couple of years, they got all that inflammation under control with a ton of anti-inflammatory medicine, huge doses of steroids, and all sorts of these other things, Enbrel and Humira and all these kind of biologics and what have you. And they finally got that under control. And then 3 weeks before my 43rd birthday, I got chest pain and I was having a massive MI, massive heart attack. And when I say massive, it was like a 10% ejection fraction. Normal should be greater than 50. Severe is like less than 30%. That's how well the heart is sort of squeezing. And I remember, going into the hospital and here I was. It was a very obviously scary time because I would say the great majority of people don't survive that kind of heart attack. The kind of blockage I had, what they call the widowmaker's blockage.
Mm.
Um, and um, and I remember sitting there, and I remember being scared, and I also like this doesn't make any sense. Here I was, almost not even 43 years old, not a lot of coronary risk factors. I didn't have really high cholesterol, high blood pressure. I was not diabetic. Yet here I was at an early age. It just like it didn't make sense, right? Just like um, normally you see someone that young have an heart attack, they've got a lot of risk factors, right? A strong family history of heart disease at a young age, smoking, diabetes, all that. I didn't have any of that. So it was very confusing. Um, the interesting thing, I don't know if I told you about this before, but gratitude when I was working to try to figure out, what can we do for people who are having these sort of issues, and I was researching everything, and I came across this idea of gratitude, and people were talking about the benefits of gratitude journal and all this kind of stuff. This is not back in basically 2000 or so, and when I started to look into it, I found that there's this whole body of literature on the physical and mental health benefits of gratitude, tons of studies. And I was shocked. I mean, these some of these findings on gratitude, the health benefits, mental and physical, both. People like who have surgery like recover faster. They're more resilient. There's the depression improves. All sorts of. If it was a pill, like we'd have everyone on it.
Yeah.
And so I had part of this program I had put together. I put together this person. I called it a personal awareness program. The acronym wasn't great, but it made sense. And so I that was part of that program. And the interesting thing was about that the day of my heart attack, a lady came in who I had spoken with 5 months before. So she called me, and she was on the heart transplant list, and she was real sick. She was in a hospital. She was on the transplant list for 3 years. They couldn't find a donor, and she lived about 2 hours away. And she called me, and she told me this story about they put this pacemaker in, and she was really mad, and she wanted to get this pacemaker taken out, and she was sicker since this pacemaker had been put in. And she was really a kind of a holistic minded person. She didn't want anything artificial in her body. And this was in, like I said, about 5 months before my heart attack when I first talked to her. And so she was had all this anger toward this pacemaker. And I said, look, I said, this is your case is really complicated. I said, I've got to see all of your records. So get all your records, get a copy, bring, make an appointment, bring all your records in. So I can go over all your medicines, and I can see where things are. And she's like, I said, but I told her out of the blue, I said, but you have all of this anger toward this pacemaker, and you've got to get over that. And she said, get over it. She says, I hate the thing. I can't stand it. I want it out. Can they take it out? And she was just adamant about getting this thing taken out. And I said, relax. I said, yes, they can take it out. But I said, I'm not sure that you're allowing the pacemaker to do its thing because you've got so much anger and resentment toward this thing. She said, yeah, I hate it. And I said, okay. I said, you need to find a way to appreciate it. She was like, appreciate it. I hate the thing. How do I do that? I said, I didn't say you had to like it. I said, you have to find a way to appreciate it. And she was like, I don't understand. So I said, okay. So I had this technique that I use. I call it the gratitude traceback method. And I told her to get a journal and start with, one day I won't need this pacemaker and they can take it out. But today, right now, I appreciate this pacemaker. And I appreciate the company who makes this pacemaker. And I appreciate that they make billions of dollars so they can do the research to develop these pacemakers. And I appreciate the engineers who design this pacemaker. And I appreciate the people who make the stainless steel to build the pacemaker, and the people who make the wires for the pacemaker, and the people who drive the trucks to deliver the stainless steel to the manufacturing facility, and the farmers who feed grow the food to feed the engineers who thought, and I said, just take it back as far as you can, and make an appointment, get your records, and bring it in. So 5 months goes by, and this one day I go into to get the lot. She was, new patient, and I'm walking her back to the office, and she says, "Do you remember me?" And I was like, "You're a new patient. Have I seen you before?" And she says, "Well, we talked on the phone like 5 months ago." And I was like, "Oh." I said, "Oh," and she told me the story, and I was like, "Yeah, yeah, yeah, I remember." And she said, "I said, how are you doing?" She goes, "I'm doing great." And I was like, "Oh, okay, great." So then the first thought was, "Oh, well, she probably got her transplant. It's 5 months, and it's about how long maybe it takes to, recover." And so I said, "Oh, did you get your transplant?" And she said, "Oh, no." And I was like, "Oh, okay." So we get back to the room, and I said, "So what's different?" And I said, "They change your medicine?" And she says, "No." And she, after the pacemaker, she had been going in, admitted to the hospital every 2 weeks. She could only walk about 200 feet with getting short of breath. And she says, "Ever since I talked to you, I haven't been back in the hospital." I was like, "Oh, are you sure they didn't change your medicine?" She goes, "No." And she says, "In fact, I'm walking 2 miles a day." And was, I was like, "And you sure you didn't get a transplant?" And because she had a really severely weakened heart, about 10% ejection fraction as well. And so I said, "Let's go and check your heart out." So we went to the echo room, and I did an echo, and her ejection fraction was about 30 or 35%, which is far from normal. It's kind of a moderate to severely weak still, but it's a lot better than 10%. And it's really not transplant kind of weakness. And, what I came to sort of decide was basically that, she had so much anger and resentment to this thing. She needed the pacemaker. The pacemaker was a biventricular pacer, it's called. And she had this thing called a left bundle branch block, and it was really wide. And that the pacemaker was by far and away the right thing to do. But she had so much resentment toward this thing. I guess she wasn't allowing it to do its thing, or whatever you want to call it. But even, just all that resentment, will raise catecholamine levels like adrenaline, noradrenaline, epinephrine, norepinephrine, and cause blood vessels to constrict and make your heart work harder. So there are some physiologic consequences to that anger and that resentment, right? We know what those emotions do. Candace Pert called those molecules of emotion, right? All of those neurotransmitters and hormones and such. And so I saw that, and I was like amazed, because I said, gratitude's a great thing, but this was like real, like physical, like transplant heart failure.
Hmm.
And I was just like in awe. So I remember when I was laying in the emergency room having this massive, heart attack, they had just showed me my EKG, which had what we describe as tombstones all across the whole EKG. And I remember sitting there and saying, you um, what can I do? Because I knew I was angry, I was scared, I was, anxious, obviously. And this woman came to mind. Now, I again don't believe in coincidence, because I had seen her that day, that same day. And I always wonder, if I had not seen her, if I would have done this. And I was like, I got to find a way to be grateful. And the first thought was grateful. How can I be grateful? I'm like not even 43 years old. I'm laying here having a massive heart attack. I probably won't survive. I've got this massive debt. I've got two kids. My kids at the time were, I think, 11 and 13. And I was like, there's no way my wife can pay this debt. Like, something happens to me. And I was like, what do I have to be grateful for? And I asked that question. And at that instant, that very instant, I saw that this pharmacist, who I was at the small community hospital that I had worked at before, and this pharmacist who I knew is running to bring this blood clot dissolving drug to the nurse. And I, she needed to deliver that, but she didn't have to be running, but she was like running. And I remember thinking, she's running for me. Now, the truth is, she would have been running for anyone else, like if they, but that's not the point. The point at that point was that she's running for me. And I'm like, I'm really grateful for that, because in cardiology, we say time is muscle. The longer the arteries blocked off, the more muscle dies and won't recover.
Yeah.
And so I felt very grateful for that. And then we had this tube of medicine or this vial of medicine, and I was like, I'm really grateful for that medicine because this, there was no cath lab at that hospital. There was no way to mechanically, physically open the artery. So it was snowing that day. It was like the beginning of March. It was March 10th, and it was snowing, and I wasn't even sure that the mobile intensive care could get there to take me, to the other hospital, which was the hospital I used to work at as well. And then all of a sudden, this gratitude just started to flow, just like I told that woman. So I was grateful for the medicine and the company that makes the medicine and the IV and the tubing of the IVs and the needles and the metal of the needles and again, I don't know what would have happened had I not done that, but that medicine typically works about 50% of the time within about 90 minutes. Now, 90 minutes is a long time for your heart to be without blood, especially as big as my heart attack was. And my artery opened up within about 14 minutes, which is really fast.
Mm.
Uh, Gratitude in every step of the way. And the
I
mobile
think it
intensive care got there.
froze there for a quick
Um,
second, Julius, but so if you want to go
one
back, I don't know
Hold on one second.
if it was on my end or yours, but
I think I got a thing that just said unstable. I'm going to switch my Wi-Fi. Might lose you for a second, but it'll come back. Give me one second.
sure.
I hope. Still there?
Yeah, you're good now.
Okay,
Yeah, it was
awesome.
just a small little
What
freeze
was
there.
the last thing you heard?
So you were sharing about that it opened up I think in 14 minutes or so.
Yeah.
Yeah.
And so the mobile intensive care was able to get there. It was like I said, it was snowing. And I remember it was a brand new truck. The funny thing was I was instrumental in getting that mobile intensive care set up at this other hospital when I was working there. And so I was grateful for the truck. I was grateful for the tires on the thing that it could get through the snow. And I was grateful for the EMS people that were there that knew how to deal with all of these acute situations. I got to the cath lab. My old partner was there. He had already called in the whole team. Everyone was there waiting for me, and they knew me. I knew them obviously, and it was a massive again heart attack. When I saw it, it was just I was laying there going, how am I still alive? Like my heart wasn't even like moving. It was so scary, but but I ended up leaving the hospital 4 days after that. They basically I told my wife, they said, most people don't survive this, and if he survives, maybe he wish he wouldn't because, you're left with this terrible heart and just heart failure and all that kind of stuff.
Mm.
Um, and I was very fortunate because I didn't have any of that. And knock on wood, that was '03, so 23. In March it'll be 23 years. And so I feel very fortunate. But all that to say, the gratitude became, a very big part of the practice. And that gratitude traceback method I find to be particularly effective. So gratitude journal is fine. But when you do a gratitude journal, a lot of time it's just kind of rote, I'm grateful for this, I'm grateful for that. You don't get the awe-inspiring sort of gratitude from it generally. And the literature is clear that it's not the quantity of the gratitude as much as the quality. Um, that's important. So when you're doing gratitude, it's really important to really try to really the number, whether it's 3 or 5 or 10, is less important. I just say take one thing, and especially take one thing that's just ordinary that we typically take for granted,
hmm
and trace that back, and you'll find just you get that warm fuzzy feeling.
Yeah. Yeah, I was gonna say what I hear when you share that, it points to whenever I've done gratitude practices or various things, or even just naturally on my own, like, I see a beautiful sunset, walking on the way out of the gym one day, and like I just have this overwhelming sense of gratitude for the beauty of that. And it's just more of a feeling that overcomes the body. So I feel that it puts you just in a different state. I don't know what you want to call it, but and then some cool things, like, I mean, then I just randomly I start hearing someone saying Donnell, Donnell, and a good friend of mine just like coincidentally in that moment that I hadn't seen in a while happened to be driving by and said hi, and so just interesting coincidences that can sometimes take place. It sounds like you had some yourself, with that experience, even tapping into that space of gratitude and um, I don't know what, it actually points to or where it heads, but I feel that there's, that deeper connection with whether you want to call it the universe, spirit, God, that kind of is activated at that point. So,
Yeah, and again, I did so well, and I can't sit here and say, well, it was because of the gratitude, but I will say because of the gratitude, I was able to keep this, I don't want to call it positive light because it's not a positive psychology thing.
hmm
It put me in a state where where a more uplifting and positive sort of state, right? And so as as a nurse, like nurses, when the doctor comes into the hospital, the last thing they want is a nurse wants never wants to take care of a physician because they're all yes, right. And but yeah, like all the best nurses that I had known that were very experienced were all like, wanting to be my nurse and stuff. And I was just so grateful and appreciative of that kind of stuff. Had I been like scared and anxious and angry, that probably would have come out, and I would have been less likely that I would have gotten the best nurses.
Right, right. Yeah. Yeah. Well, that's an amazing story. And thank God that you are still here with us today to be able to be here sharing this with everyone. And
I
also
appreciate
now
it.
what you've kind of developed through your career. So I'd love to kind of talk a little bit more now of what you're doing because you have some cool things that are happening. So if you'd share about that.
Yeah, so I did a few things after I left that practice eventually, and I just got burned out. I was there 11 years, and things started changing in medicine. Reimbursements were down, and it was just, it became a stressful time. And I did several other things, but eventually I ended up at the FDA. I was at the FDA a couple of years, and they had a great new program called TAP, and I was part of that. But then when I left, I was trying to decide what to do, and should I just retire and kind of ride off into the sunset? And I would have considered that, but I really felt as though I still had this experience that I never felt I could teach because I I never felt like I was trained in this. Most of this was stuff that I had, whatever you want to call it, developed or come up with. And I felt a little bit like a fraud in that, I was like, was I qualified, to do, I'm not a counselor and this kind of stuff. Um, and so I decided, rather than thinking of this as teaching, I look at as sharing. So I'd like to just share my experience with whoever it is, and if they find it helpful, great. I would say most people are not into this sort of stuff, and it's not for everyone. Maybe it's for just a small percentage, but it's still a sizable, and even honestly, even if it's one person, to me, it probably doesn't matter. And so I just felt drawn to try to find a way to take what I did one on one with patients, face to face, and try to transform it to something else, digital, in a global sort of way.
hmm
So that's what I'm working on now. The company's called Gratefully Well, and it's I call it an educational digital platform. So I have a newsletter on Substack.com called Gratefully Well, and I've had that about a year now, and I try to write about all of this sort of stuff. And importantly, it's nothing that's replacing your medical care. It's really as an adjunct, right? And this can be done along, the gratitude as an example can be done with your medical care. And in fact, in 2005, my late wife had breast cancer. She had metastatic breast cancer at that time, and they couldn't operate, and so they only offered her chemotherapy. And so I was like, she's going to have to do the gratitude. I was like, how do you do gratitude when you're getting chemotherapy every week? They really were trying to hit it really hard, so that she was getting powerful sort of drugs. It's like, how do you stay grateful when you're getting this every week? You're getting weaker, you're feeling sicker, and how do you continue to do that? So I came up with this idea of a recording, so she would listen to this every day, but especially when she was getting her chemo. And basically it took, I used her doctor and like appreciate the doctor and his experience and his knowledge for diagnosis and knowing how to use these drugs, appreciation, gratefulness for the nurses that they knew, how to deliver the drugs, how to start the IVs, how to use the portacats and things like that, the technology, that all the stuff that's available, all the testing that's available, and then the drugs themselves, not to let it in again in this positive sort of way, but in this grateful way that you sort of let the drug in to let it do its thing and be grateful for the company and the drugs and the technology and everything to do that. And, mindset is so, again, this is something we don't emphasize in medicine, but we have studies, for instance, that show that they've done studies where they take women with breast cancer and they test their white blood count at home. And then when they get to the waiting room while they're sitting there waiting, and then when they're getting, before they're sitting in the chair waiting to get the chemotherapy, and then after they get the chemotherapy, and it actually shows that the white blood count starts going down when they're sitting in the waiting room after they leave the house, before they even get the chemotherapy.
Hmm.
And so, we've got tons of evidence, to show how important the mindset is, right? These beliefs and these thoughts that we have. And so the positive psychology stuff is a little bit challenging because, how do you stay positive when you're sick and you're getting sicker? And people in the positive psychology realm, sometimes the patients, they get so worked up, like, I can't have a negative thought. I can't have a negative thought. I can't have a negative thought. Like that's a negative thought, right? Not worried about not
Then
having
you
a
stress
negative.
yourself out about your own thinking.
Exactly.
Yeah.
Whereas this is completely different. This is like you have negative thoughts and you're upset and whatever. That's fine. But at some point when you're done having that thought, right? How do you turn that around? How do you stop that cycle, right? Because those negative thoughts run away with themselves, right? Imagine you've got, you're laying, you're getting chemotherapy, you're laying there. Sometimes it takes 3 or 4 hours to get your chemotherapy, right? And you're laying there and the beds are not that comfortable. Maybe your back starts to hurt and you start to like, trying to get comfortable in the bed and you're, oh God, this back pain. And then all of a sudden you have this thought, oh, you know, breast cancer can go to the spine. That can cause back pain. And, Mary, she had back pain and had spinal mets. And, and maybe it's not just in my spine, maybe it's all over, right? And it's everywhere. And those thoughts run away with you, right? And there's no good way to sort of, how do you stop that runaway thought? Well, the gratitude is one way where you can, when you're ready, you can just say, you know, find something to be grateful for, and that stops that runaway thought in its tracks.
Mhm.
So it's a tool, right, or a technique to be able to use. And I like the traceback method. I like that method. The journal is great too. But you got to sit down. It takes time. You got to do it. Whereas this traceback method, you can do it. I call it on the fly. You can be stuck in traffic. You could be in the slowest line in the grocery store. You could be getting your chemotherapy, and you can do this on the fly. And people have found it to be very effective.
Yeah, that's very cool. Yeah, with your sharing, I mean, it just made me think about your kind of intervening with that, loop of thoughts that can just take you in this, spiral. And I think for myself, when I find myself in those situations, the first thing is just being aware of them, noticing that, okay, it's just a thought and that I don't have to engage with the thought. I don't have to believe the thought. It's not necessarily true just because I'm having, from your example, that I'm having this pain in my back that now I have, the cancer spread to that area. And so just kind of having that awareness of the thoughts being just that, a thought and not actual potentially a reality. And then, as you stated, like where you can take that then to a different place through gratitude and uncover something, much deeper and a sense of peace that can hopefully even bring physical healing to you. So,
Yeah, and I think that's another thing. I developed this mini course, an email mini course. Like I call it the physiology of thought. Like one of the things we don't talk about is how powerful thoughts are, right? That thoughts can actually change your physiology. If you think about it, if you get startled, something happens and you get afraid, what happened there, right? You might notice your heart racing, maybe your palms get a little sweaty, your blood pressure, if you measured it, would be up. And that was just a thought that caused a change in your physiology. And we understand the neuroscience, behind that, how that works. You whatever the thought is, you see, let's just say you're afraid of snakes and you see a snake, right? And your heart starts racing or whatever. Again, if you measured your blood pressure would be up, your heart rate would be up, your palms would be sweaty, your pupils would dilate. And we understand how that happens. We understand the neuroscience, of that. And so if that in the acute situation, the snake goes away, or you find out maybe it's not really a snake you thought it was, like then everything kind of goes back to normal. So the system is set up in that fight or flight kind of thing to deal with that. The problem is that for most of us, we're in that state continuously, right? If you have a job that, a boss that's you hate or whatever, or you have a terrible, situation at home or something like that, we're in that chronic state of, fight or flight. And so adrenaline levels are high, cortisol levels are high. So you develop high blood pressure, hypertension, you have, cortisol raises blood sugar. So those kind of things, all these kind of things happen, but it's all from ultimately, some people would call it an emotion, but I always say emotions come from thoughts, right? And, you don't just have, most of the time, you don't just have a spontaneous emotion. Emotion, if you're afraid of something, there's a thought that, you were afraid of it, right? Or you're anxious, there's a reason that you might be anxious about it. It doesn't just, if no one ever told you snakes were poisonous and you didn't know anything about snakes, you wouldn't have any reason to have a fearful thought, right?
right.
Until you sort of learn that. We don't come out of the womb being afraid of snakes, as an example.
Exactly. Yeah. And I think that points to beautifully, like, what Michael Neal shares with his book, The Inside Out Revolution, and all his work, that inside out understanding that it's not necessarily our circumstances that are creating these feelings that we experience, but rather our thoughts about those circumstances that ultimately lead to us then having, whatever emotions may arise and then whatever may change in our physiology as well as a result from that. So, yeah, and I think, for myself, just I have seen firsthand now that I have this awareness how much there is that connection. And for me, when I start getting stuck in those spirals of thoughts, I just realize, as I mentioned earlier, like, there's a great analogy about they talk about the sky, that we're the sky and our thoughts are just the clouds passing through the sky, and we don't have to do anything about them either, as you were talking about before, sometimes we dig into the psychology of it, like, oh, let me, or I know I've been guilty of this, let me try to change this thought. I need to think a more positive thought. And then even being scared of my thoughts, thinking that if I think this thought too much, it will actually, happen. And so I think it's given me a lot of peace and freedom to realize, like, okay, I can just let this pass by, this thought come and go, and I don't have to do anything about it. It's not necessarily going to happen. Most of the time our thoughts don't actually, turn into something real. So, yeah, so that's been very helpful.
Yeah, I think those are important points. I always say, I used to believe that, an event was either positive or negative, whatever it was. And it took me a long time before I realized the event is really neutral. And people
Mhm.
always say it's how you respond to the event. And that might be true, except it's difficult to choose a positive response to an event that you may not perceive as being pretty very positive. And so it's to me, it's not really a choice of how you respond. It's a choice of how you perceive the event. And I
Mhm.
used to think, again, what do you mean? Like an event, and well, the what made me aware of this was literally 30 plus years ago when a friend of mine, it was my PA, had gone to Romania to adopt a son, a boy, a 2-year-old boy. And they brought him back, and mom was also a PA, and she took like 6 or 8 weeks off or something like that. And he took a couple of weeks off. And then when she was getting ready to go back to work, they said, well, let's start to take him to the daycare and make sure he gets used to it and whatever. So they went one day and he played with the kids and everything. They sat there and everything was great. So they went back the next day, and the teacher said, well, why don't you just step out for like 10 seconds and then just come right back in? So I said, okay. And they went to step out. And as they were leaving, the boy had a meltdown. He was just had a meltdown. And the mom has, the typical sort of mom reaction, which is what most people would have, is like, I'm going to quit my job. I'm going to stay home and I'll just take care of him. And we're just going to have to live on half a salary, one salary, whatever. And that's just the way it is. And Gene, my friend, he said, I was elated. I was like, elated? I was like, what's wrong with you? He goes, no, 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 you don't understand. He said, my biggest concern in adopting this 2-year-old child was that he would never bond with us.
Oh,
Oh, and all of a sudden, I had this like awareness that here was this event that most people would see as a negative event, and yet he found a way to look at it as a positive. Now, granted, it's because of what his belief was, but regardless, and that's when I sort of started to realize, like, wait a minute, is an event really the issue, or is it really the way we choose to perceive the event? And the reason that's important is because of the choice, right? And once I sort of realized it was a choice, then all of a sudden it wasn't being like if it was a negative, if I saw it as negative, it wasn't being done to me. It was my choice of it was essentially I was doing it to myself. And
yeah.
when I realized that, that changed everything because now I could stop. If I was doing it to myself, I could stop. If it's being done to me, I can't stop that. Right.
Right. Yeah.
And so I found that to be very,
Yeah, very empowering. Yeah, I mean, I think that points to also just I don't know that we have so much um power within us to choose our how we experience the world, and we can really experience so much joy, peace, and freedom really in any moment, even we're in the most challenging of circumstances. I mean, even potentially in the middle of a heart attack, as crazy as that may sound, sometimes, we talk there's a exercise that Michael Neal had us do, that he asked to think of a time when we felt like we were kind of the eye of the storm of a hurricane. That's the calmest, centered part of the storm. And to think of like the outer skirts of the storm being our thoughts. And so when I got put into a group, everybody kind of came up with traumatic experiences that they had been in. And, it's just kind of interesting to see that even in the midst of some of the scariest times for each of myself and then each of the individuals in the group, that we were able to find this calm, this inner peace, this, inner wisdom of what next steps to do in this, scary circumstance. So even for yourself, sharing about having that heart attack, and for you to think at that time, oh, let me turn to gratitude. I mean, that's pretty phenomenal, to go to that place. Had you could have gone a million other places in your thoughts of like versus turning to that. So
yeah. And but then again, Viktor Frankl did it in a concentration camp, right? And he found people that were doing it. So, which is, or maybe the worst place, right?
yeah.
And yeah, so it is always possible, but it's challenging. And again, it's not, you know, to say that someone is, to blame. Or if, like I always say, if you want to choose to be the I call it the victim scenario, there's no right or wrong here. It's like you can choose that, but realize that choice, that path, the victim path, as I call it, always leads to negative emotion, ultimately leading to misery, right?
Mhm.
Whereas the non-victim path, or what I like to call the victor path, right, always leads to peace, right? It's not necessarily a positive emotion like joy or happiness or whatever, but it's, it ends sort of in peace. And that's a choice. But there's no right or wrong. I always say, like, misery isn't better than peace. It's just more miserable.
Right, right. Yeah, and that's the cool part is we each get to choose what path we take and like you said, there's no right or wrong. So,
But once
um
you realize you have a choice, again, to me, and I haven't found everyone sort of find this helpful, but for me, that was so helpful because it empowered me, right? Like, even if I was choosing the victim path, at least I knew that I was doing it, and that was very different than it being done to me.
yeah.
Um,
Like life is happening, not happening to you. You get to be kind of somewhat in the driver's seat of that. So,
so,
yeah, yeah, very cool. Well, Julius, before we wrap up here, is there any other things you wanted to share?
uh, I think time flies when we're having fun,
I
right?
know, I know. I
Um,
just glanced down and I realized we're already almost at an hour here.
yeah,
So I do have one last question for you
yeah,
before we
yeah.
go, but I did, well, I'm
Mhm.
just curious if there's anything else you wanted to share before that.
No, I don't think so. I think we covered a lot of ground.
Yeah, yeah. I'm so grateful to be here with you. And so, also, before I ask you the last question, where can people find out more information about you and the Gratefully Well?
So the best place is Substack. If you go to substack.com, which is a platform that people aren't familiar, that hosts newsletters,
Okay.
it's kind of a cool place. So you can look me up under my name or under Gratefully Well, either one. The newsletter is free. There's a paid version as well, but there's a free version.
Yep.
And then my website is gratefully well.com. There's on there, there'll be the 3 day gratitude. I used to have a gratitude challenge. I changed it to the 3 day physiology of thought mini course. That's free. You can download that or participate in that. And it, again, just an exercise to sort of help you understand the power of thoughts. And those are probably the best things. I have a book on Amazon that you can find called Holistic Health Pathways. And that book is specifically about the physical and mental health benefits of gratitude. And so that's available.
Awesome. Love that. Thank you. I didn't know about your book, so I'll have to check that out. Very cool. Um, well, Julius, so I like to ask all everyone I interview if this was the last talk that you could, for whatever reason, give to the world, what may you want to share? What message would you want everyone to know if this was your final talk?
Yeah, that's that's a tough question. I think for me, if I boil down what has been the most helpful for me, which I've already sort of said, but I think I like to think of it as the main message of Gratefully Well. It goes back to this idea of choice, that you have a choice in how you perceive things. You have a choice. You don't have what thoughts you believe and what thoughts you don't believe. As you said, you can think of the thoughts as clouds. They come and they go, they move through. You do not have to believe all your thoughts. You don't have to believe. In fact, I always say, don't believe anything that you're thinking. And this idea, of how do you choose to perceive, your life or the events in your life? You can't dictate the events, right? The events are going to happen. If you perceive the events as neutral and you get to choose how you perceive them, uh, I just think that is, um, for me, it took what I was really in a place of just misery. I was severely depressed and such. And when I found that all of this wasn't being done to me and that I had a choice and I was doing it to myself, that just was life altering for
Yeah, I can imagine that unlocks a lot for sure. Very empowering. So I love that. All right, Julius. Well, it's been wonderful to be with you. Thank you so much for your time and
me. Thank you. I
for
appreciate the
all
opportunity.
your wisdom that you've shared. And we'll have to do this again another time.
Anytime. I enjoy it, and always great to see you.
All right. Thank you. Bye-bye.